Thank you for joining us in The Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me today is my colleague and co-author, Wendy Benson. We're receiving some very positive feedback from viewers about this series, and we're thrilled to continue sharing this extension of our first book. Today, we're talking with a very special guest, addiction therapist, Angela Morton. Angela is the prevention supervisor at the Crawford County Drug and Alcohol Executive Commission. She is also a dear cousin of Wendy's, so we are even more excited to have her as our guest. Thank you for joining us. Wendy, take it from here.
Angela, we are so excited to have you. Thank you so much for joining us.
Thank you both for having me. I appreciate it.
So just to kick us off, Angela, why don't you tell us a little bit more about what you do?
Okay, I supervise a team of prevention specialists who work throughout the community and in schools, and we work with various coalitions to prevent substance abuse. And much of that involves reducing risk factors for substance abuse and increasing protective factors. And that is across the lifespan. So we work with children, young children in schools, pregnant mothers, babies. We put programming in for the whole range of life into adulthood to prevent people succumbing to substance abuse.
And when I think about, who would be at risk, it sounds like it's across the lifespan, but in general, who do you characterize as most at risk for drug and alcohol addiction or abuse?
Well, I think there's a lot of talk about, I think the first thing people think about is like genetic predisposition. If you're raised in a home or have family members who use drugs or alcohol, that you have more of an inclination toward using substance, and that is a big risk factor. So it increases a person's risk of dependence. But really, anyone can become addicted. So we talked about COVID and how so many people are isolated, and maybe people who are already, smoking cigarettes or vaping are doing more of that, or people who have a casual glass of wine and can drink responsibly once or twice a week are suddenly drinking every night, or they're drinking 3 glasses of wine instead of 1. So anyone can become addicted, and especially under stress. But a lot of people can drink responsibly. It's those who start to increase the amount and the frequency and become one of the more than 14 million adults who are diagnosed with like an alcohol use disorder or substance use disorder. People start to gradually add other substances. So some people think, well, no, it's no big deal. I'm smoking a cigarette or I'm having a glass of wine. But when they're no longer feeling the effects of that and need more and more of it, it starts to change the structure of the brain. And we could do a whole nother session on what happens to the brain in addiction, but it can happen to anybody.
And so when we think about the risk factors, what are some of the risk factors for someone having an addiction or an abuse situation?
Well, one of the things that we really aim to do, especially with youth, is to increase the age. We want people, if they're going to ever try a substance, the older the better. It's a strange way to say it, but the age of first use is crucial. So we aim to delay first use, because statistically, adults who take their first drink before the age of 15 are 6.5 times more likely to have an alcohol use disorder than if they wait until age 21. So that legal drinking age is actually data driven, and the recent increase of the tobacco age in 19 states to 21 says the same. But the number one risk factor for substance abuse is trauma. So a lot of what we do is try to reduce trauma in the community, and we have a lot of different ways we do that during a pandemic, because we've got homelessness and food insecurity and job loss and poverty and all those social determinants of health. Mental health issues, parental addiction or parental lack of involvement, those are all things that contribute to a person's likelihood of engaging in substance use.
And then if you yourself or someone that you're really concerned about maybe having a concern or an issue, like what are some either questions they can ask themselves? What are some ways that people can know, like, ooh, I might be hitting a slippery slope here? What are some things that people can do to assess that?
Well, there's something we call the CAGE questionnaire that's pretty common in drug and alcohol counseling and also mental health counseling, which is my background. And you ask yourself 4 questions, or a doctor, anybody can ask anyone really. Have you ever felt that you should cut down on your drinking? Have people annoyed you, or have you been annoyed by people criticizing your drinking or drug use? Have you ever felt bad or guilty about using a substance? And have you ever had a drink or a drug first thing in the morning to steady your nerves or to get rid of a hangover, like an eye opener? So those 4 questions, have you ever tried to cut down? Do you get annoyed? Do you feel guilty? And do you need an eye opener? They can be not a diagnosis, but an indicator of where you might be heading into some compulsive or problematic behavior with substances. And it would be really important to talk to somebody you trust, a family member, friend, practitioner, counselor, especially your doctor, because they can kind of guide you in the right direction if it seems like you're heading into dangerous territory. And it's also, go ahead.
I was just going to say, and I know that you have shared when we've talked before that even if someone doesn't have necessarily somebody that they feel comfortable reaching out to within their social circle right now, or maybe they don't have an established relationship with a medical provider right now, that there is a national hotline that people can reach out to.
Yes, there absolutely is. So locally, if you know of a local, like county or in your town, a drug and alcohol facility, certainly can reach out to there. There is a national helpline with SAMHSA, which is samsha.gov. And I think Beth will be putting that on the screen at the end. It's the Substance Abuse and Mental Health Services Administration, and their national hotline is 800-662-HELP.
HELP,
So,
H-E-L-P?
Yes, it's 4357. But I reiterate that it's important to talk to your doctor or a trusted professional. And if you happen to be a person in recovery and have not talked about that with people, many people working in recovery know that it's important to do a lot of truth telling, that you need to be telling people what you're going through and what you've battled. And your doctor is somebody you really should tell about that. That if you say, hey, I've not been using whatever, a prescription drug that somebody became addicted to, or alcohol or tobacco or marijuana, anything, that to be able to say to your doctor, this is something I struggled with and I stopped and I'm in recovery, they need to know that too, so they can guide and help you in the correct ways too.
Absolutely. And we've had some patients that we go to, the doctor with, and that question comes up. And I think it's a piece of the puzzle that the doctor definitely needs to know about to treat the whole person. So I definitely make sure that we discuss that during our meetings.
That is important.
And one of the things too that I know we've talked about is we all want to educate and empower our kids, the kids and children in our lives. When is the best time to start talking with your children about substance and alcohol potential for abuse and addiction?
It's a really good question, and it's very much what we do for a living, and there is no age. So if there's a teachable moment that you're with your young toddler, that somebody's smoking a cigarette and they ask what that is, that you can start talking about substances and what they do to the brain. And if somebody's acting silly and they're drinking, you can use that moment when they say, why is he acting or why is she acting that way? So you can talk about it throughout their lives. And the more you talk about it and repeat those messages, the more when they become a teenager or younger, because a lot of use starts at like age 11 or 12, that they're going to have that planted, that my parents have talked to me about this, or the caring people in my life have talked to me about this as long as I can remember. So no, thanks, man, I don't want that. Like when somebody comes up and offers them something, or, hey, do you want a drink? Everybody's doing it. No, thanks, not today. That they can have the confidence that you've talked with them and they know the messages throughout their lives. So in terms of, you and I've talked about like some of those, when we're having conversations, we don't call them protective factors, but some of the protective factors, and the number one protective factor is eating dinner with family. And people say, well, I'm not an addict and I didn't eat dinner with my family. Or there are addicts who say, we ate dinner together or once in a while. But statistically, when we research people who became addicted and people who didn't, the number one factor in common for people who didn't become addicted was sitting at the dinner table with family and having dinner. So statistically, teens who eat dinner with family less than three times a week are twice as likely to engage in alcohol or tobacco use, and 1.5 times more likely to use marijuana than teens who eat dinner with their family 5 to 7 times a week. So
Wow.
it's powerful research that it's data-driven work that we do. And we know that sitting down and eating with your kids and being there and looking them in the eye and talking to them about their day is powerful.
Yeah, I have 2 children, and both very athletic in sports and in after school activities. And before the pandemic, we would eat dinner maybe once or twice a week. Now we were eating dinner 7 nights a week together. So it will be interesting to see, hopefully later on, if any good comes of this pandemic, that the families are getting closer, they're spending more time together, and maybe those numbers in the next, I don't know, 5 to 10 years will go down. It'll be interesting to see how that works.
It really will be to look back on it with some information about, hey, what really happened during that time. And from a personal, a family perspective, emotional perspective, your kids are going to remember that when they say, hey, what happened during the pandemic? We started eating together all the time as a family, and we were together all the time. Those are the silver linings that are coming from it. But maybe it's also going to make a lot of people say, all right, everybody's home at what time? There's a half hour, we're all at home at the same time, and we're all going to sit down together and just be together. And that's really what it's about. Like sometimes if I want to sit at the table and eat dinner, my son's like, really, can we eat on the living room floor? And so we'll have a pizza party on the living room floor. And it's the same concept of just being together. The idea is having caring adults in your life that you can communicate about what's going on. So if something is going on and you're talking to them every day, they're going to be more inclined to talk to you about it. It also builds self-esteem, coping skills and decision-making skills. Refusal skills are really important too, that we maybe train kids to say, hey, it doesn't matter what age, if you know that they're in the neighborhood and they're playing with other kids, and you ask them, what would you do if somebody tried to offer you a cigarette? Or what if somebody said, hey, do you want to try this drink, or do you want to take this pill? We need to teach kids to be able to say, no way, I'm not doing that. And whether they say, my parents told me not to, or at my son's age of 15, where he wouldn't say, my mom doesn't want me to. He'd say, no, man, I don't do that. Or no, thanks, not today. Or something that isn't going to maybe invoke further peer pressure. But there are a lot of things. We could end up having other sessions on the social determinants of health, mental and physical health, but taking care of your body and making sure there's proper medical care and increasing access and equity to healthcare is really important, because that's another protective factor, just being healthy and taking care of yourself.
It just is a great, mental health is such a huge piece of the puzzle that we really need to think about. And I know there's this stigma against it, and there shouldn't be. Nobody should be embarrassed to talk about it and ask for help. So I'm actually really happy that we're having this conversation.
Me too. I think it is really important. And thank you for mentioning mental health. It's on I glance back and forth at my list, but those are, having good mental health is a protective factor, but having an untreated mental illness is a risk factor. So making sure that if your child is having trouble, or if you're having trouble, especially we keep bringing it up how to be a confident patient during the pandemic. If you're struggling, it takes courage and strength and bravery and vulnerability, but reaching out and telling someone, hey, I'm not doing so well with this, rather than pouring the other drink or smoking another cigarette or using a drug, that to be able to say, I really need some help. It shows strength. And by doing that, and us just talking about it, reduces the stigma of drug and alcohol use and mental health issues.
There's such important points. I think that talking about having a plan for either your child or even you yourself to say, you know what, I'm just not in the mood to do that today. Knowing that that's an okay thing to say, to be able, to refuse something in a way that person feels comfortable. Thinking about, the whole person as we talk about how, so many parts of our lives has changed and how we cope with that. When we think about moving forward and building resilience, tell us a little bit about that, Angela.
I like to kind of wrap up to that. And I think that is really important, because we talk about all this heavy stuff, and self-care is really behind all of it, that you're less likely to succumb to some of these issues, or if you already have these issues, or if you're in recovery, all the things that you probably do every day with all of your staff, of the importance of healthy eating habits and good sleep and exercise, and just establishing some goals for yourself, whether you're renewing a new hobby. I love seeing posts on social media when people are like, hey, I haven't made jewelry in years and I'm doing this again. Or I used to love painting and look how I refinished this piece of furniture. Just resurrecting a new hobby or something that you've always wanted to do and you haven't done before. Get out your Bob Rossi, the videos, and start painting. But having some kind of goals and a sense of purpose are really important for everyone, let alone during a pandemic. And those healthy eating habits and sleep, problem-solving skills, and the importance of, during physical distance, to not have social distance or emotional distance. So we may not be able to be in the same room and we miss each other like crazy. But being on a screen and talking together is a substitute for that for a while, or picking up the phone and calling somebody that you're missing, or knowing they might be missing you too. To really have those connections and going through this together and not doing it alone, and not being afraid to ask for help. And your doctors are probably doing a lot of telehealth right now, and most parts of the country. We still do some face-to-face when able at my agency, but we do a lot of telehealth. So if you're nervous about going to a hospital or going to see a doctor, make some phone calls and find out if you can do that by phone or by video. Get the support that you need.
All right, well, thank you to Angela Morton, Prevention Supervisor at the Crawford County Drug and Alcohol Executive Commission. If you would like to connect with a resource in your area like Angela, visit www.samhsa.gov or call 1-800-662-HELP, H-E-L-P, or 1-800-662-4357. In the meantime, be sure to check back with us as Wendy and I continue our conversations with medical experts as we help the Compton patient in a new world.
Thanks for having me today.
We loved having you, Angela. Thank you so much for being with us. And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.